It started with a headline. Mental health diagnoses soaring. Are we overdiagnosing? The words echoed through hospital corridors, parliamentary debates, and dinner table conversations across the UK. When Health Secretary Wes Streeting suggested that the rise in mental health conditions might be linked to welfare reform, implying perhaps too many people are being labeled as unwell, it struck a nerve. Not just among clinicians like myself, but among millions who've struggled in silence. Let me take you into the reality behind those headlines. Meet Alex. Not their real name, but their story is real. A 28-year-old from East London, Alex came in exhausted, anxious, detached from life. They'd lost their job during the pandemic, were evicted shortly after, and had been couch surfing ever since. When they were diagnosed with depression, it wasn't a shock to anyone, least of all Alex. But outside the clinic, some questioned, was this really clinical depression, or just the fallout of a broken system? That's the heart of the debate. Some politicians argue we're medicalizing hardship, that we've grown too quick to hand out mental health diagnoses for what might simply be normal human struggles. But here's the reality. The rates of depression and anxiety in the UK have surged since the pandemic, particularly among young people, people of color, and those in lower socioeconomic groups. According to the NHS, referrals to mental health services in England hit a record 5 million in 2023. That's not overdiagnosis. That's a crisis. What we're seeing isn't people faking illness to avoid work. It's people cracking under pressure. Sky-high rents, insecure jobs, social isolation, the endless pressure of life online. The brain doesn't exist in a vacuum. When society struggles, so does mental health. Still, the concern about overdiagnosis isn't entirely unfounded. The danger lies in turning every emotion into a disorder, pathologizing sadness, grief, even boredom. But this is where a powerful tool comes in: social prescribing. It's a growing movement where, instead of, or alongside, medication, patients are prescribed community activities, exercise, gardening, art, or volunteering. It's not a quick fix, but for many, it's life-changing. In Salford, for example, a pilot program linked lonely patients with local walking clubs and support groups. 1 year later, emergency mental health visits dropped by 38%. That's not just a stat. That's dozens of people who didn't reach crisis point. So, are we overdiagnosing mental illness in the UK? Or are we finally starting to see it? Name it. Treat it. The truth may lie somewhere in between. Yes, we must be careful not to label every distress as disease. But we also cannot afford to gaslight a generation crying out for help. And here's the bonus truth no one talks about. Mental health isn't just in your head. It's in your housing, your paycheck, your relationships, your postcode. Until we treat those root causes, we're just papering over the cracks. If you've made it this far, here's a question worth asking. What if we stopped debating if people are unwell and started asking why? Because healing isn't just a prescription. It's a system built to care.